St. Luke's Emergency Department is ready to serve you and your family. Our spacious 34,000 square foot ER provides more room to serve our growing community in a caring and family-centered environment. Hello, I'm Ryan Sunderman, Medical Director of St. Luke's Emergency Department. I'd like to take a moment to show you what makes our ER the right choice for you if you should need emergency care. Our goal is to provide easier access and faster service for you and your family. Each year, St. Luke's ER treats over 50,000 patients. That's about the same number of people who live in the town of Ames. And every month, we respond to about 600 ambulance calls and nearly 30 helicopter transports. And speaking of our helicopter, St. Luke's ER is home to Lifeguard Air Ambulance. The blue helicopter has been a familiar sight in the skies around Cedar Rapids since 1981. All told, Lifeguard has flown over 6,000 emergency flights. St. Luke's Emergency Department is staffed by doctors trained in emergency medicine, and our specially trained registered nurses and emergency medical technicians provide the most immediate appropriate care. A special feature of St. Luke's ER is 2 separate entrances for patients who arrive by car and those who arrive by ambulance. During the day, if you arrive by car, please take advantage of our free valet parking. When you enter our emergency entrance, expect to be greeted by someone from guest relations. They will do an excellent job of guiding you through your ER visit. Your first stop will be a meeting with a triage nurse. Triage is the process of prioritizing patients according to the urgency of their conditions. If your medical need is more urgent, you will likely arrive by area ambulance or one of our other ambulance partners. A unique feature of St. Luke's ER is our ambulance bay. It is enclosed with garage doors to protect you from the elements. Adjacent to the ambulance bay is a treatment room, decontamination rooms, and a dedicated EMS public safety workspace. The separate entries into St. Luke's ER decrease congestion and assist with faster triage. Of course, all patients are important to us, and that's why we do our very best to make sure you are quickly seen by a doctor. However, there are times when several ambulances may arrive at once, and we must treat these more urgent cases first. To keep your care moving, our triage nurses may order x-rays or lab work, so when you see a doctor, he or she has everything they need to treat you. From triage, you will be moved into a private room where bedside registration takes place. And as you anticipate the doctor, please enjoy watching one of our flat-screen televisions. To better serve our community, we have 34 private rooms. In an effort to streamline care and reduce wait times, all of our rooms are set up exactly the same, and supplies and equipment are in a central location. There are 4 large critical care rooms, and additional rooms can be converted into critical care rooms if there's a need. Our critical care rooms are equipped with all the latest technology. The way our new ER is laid out, we bring all of the equipment needed to you, like wireless heart monitors and EKGs. St. Luke's staff also uses Vocera, which enables instant wireless voice communication that users control with spoken commands.
Dr. Sunderman, the lab test you ordered for the patient in room 7 is ready for you to review.
Okay, thanks. I'll be there in a moment. As you can see, Vocera increases productivity and communication among staff. St. Luke's ER is designed like a racetrack. There are 3 nurses stations, 2 in the racetrack area and 1 near the critical care rooms. The doctors and nurses' workstations are placed in the center, surrounded by patient rooms. This layout allows for a faster flow and easier access to patients. There is also consultant workspace for specialists and x-ray viewing capabilities. To better serve you, we have 2 private consultant rooms, which are available to doctors to speak with families in a private setting. These rooms have a sofa, chairs, television, and telephone. Other highlights of St. Luke's new emergency department include a spacious and aesthetically pleasing lobby and a patient activity cart, which is stocked with Game Boys, DVD players, playing cards, crayons, and coloring books. Another amenity for patients and families is wireless internet access. If patients or visitors don't have a laptop, they can check one out. And while St. Luke's works hard to eliminate waiting, sometimes it can't be avoided. That's why the hospital started using guest pagers, which allow patients a little more freedom. At St. Luke's, our mission is to give the health care we'd like our loved ones to receive. We consider it an honor and a privilege to care for you and your family. We hope you never need emergency care, but if you do, we'll do everything we can to make sure you have the best possible outcome.